Hello, everyone. Again, welcome you all to this episode, which is on nutrition during life cycle. And in today's episode, we'll be dealing with the nutritional importance for infancy and childhood. So, let us start with the definition. Infancy, is termed as a period from birth to 12 months of age, and nutrition plays an important role. When I was talking about pregnancy, I emphasized on nutrition and its importance even in for lactation, and I told it is also important for the infants, that is newborn babies also. So that means to say nutrition is of great importance during infancy, and there is definitely a physical growth in the first year of life, which is very crucial and critical for the growth of all the major organ systems. And nutrition in this phase is very important and has got impact on the growth of the fetus, growth and development of the fetus, and that the infants. So now, nutrition adequacy is very important for the overall development of the organs in the infants. Now, I told you it is a rapid growth period, and there is a considerable growth also over there. However, when it passes, that is after the completion of the first year, in the preschool and school age, if you just consider, the growth rate will be there, but in a slower manner. That is the pace that it was there in the infancy period, that is 0 to 1 year, will be there, will not be in such an intensity during the toddler as well as the school period. So children will have individual growth pattern after that, and there may be, that is the height and weight can be followed by with no growth for some times, and then growth, or because there may be some health issues during a short period of time wherein the weight can be reduced or can come down. So such things happens, and there is variation. That is why we say that the growth of the children, that is the pattern in which it is there, slightly deviates from each child to child after the first year of the life of the infancy, that is during the toddler and the school age. So that is why we say it is very important, that is nutrition plays an important role in the life of the growing children. Now, the childhood, that is a toddler, is the young child who is learning to walk and toddle, we say, and this is referred to as the second stage of development after the infancy. That is up to 1 year, it is infancy, and after 1 year, up to 3 years, it is referred to as the toddler. And this year period also is very important, because here major development takes place, that is the motor skill development takes place in this age group. That is why we say it is very important. So there are milestones also. I'll be talking about the milestones and other things. So let us start with the growth and development and what happens during the infancy as well as the toddler, that is school age group. Now, as I said, this period is where the growth is very important, that is especially the infancy, that is up to 1 year. Therefore, nutrition needs per unit body weight are higher during infancy than at any other time of life. Now, apart from the physical growth in the first year of the life, is also critical for the growth of many major organ systems. So nutrition definitely during this time influences how an infant grows and the thrives also. So normal growth is strong indicator of nutritional adequacy, and therefore the overall health of an infant is very much dependent on the nutrients or the supply of nutrition itself. Now, the feeding of infant is also very important here. It is, we refer it to as an art also. And this process should be done with utmost care and probably giving more importance to not only nutritional needs, but also to the hygiene also. So human milk, which provides most of the nutrients to the infants for the first 6 months, is okay. It is hygienic, but thereafter, the infant's physical development and psychological maturity calls for the need to introduce solid foods to the diet of the infants. And now it is in this stage that the mother or whoever is taking care should exercise caution in introducing the right type of foods in the right quantities and qualities also, and at the proper time also. So improper feeding practice can result in certain health issues that can have its impact in on the growth and development of the infants also. Now, today in this episode, we will discuss the normal growth and development of the infants. We will also try to understand about the nutrient needs of the infant, which will help them to grow normally. And this episode may give us an idea about the right type of solid foods to be given to the infants. That is the weaning food, what I am referring to. And we will also get familiar about the health concerns of the infants that are related to nutrition itself. So let us start with the growth and development of the infants. Now, the first indicator is the birth weight, what we usually take care. Now, the birth weight is the best indicator of how healthy a child is likely to be during the first year of life. Now, of course, the risk factor is associated with the low birth weight of full-term infants are different from that of the premature infants with the low birth weight. So, premature is before the full term, that is 9 months. If they are born in 7th month or 6th month, sometimes even 8th month. So we have got a variation. They are premature infants who definitely will have a lower birth weight. But the child, the baby who has completed full term and still is a low birth, that is, I mean, has the birth weight is very much low. Then we say that there is risk factors associated. Of course, preschool, premature infants also are at high risk itself, but this also is a that is the risk factors are associated with them. Now, the normal birth weight of an Indian, for an Indian atmosphere, that is Indian environment, the Indian infants born to healthy, I'm talking about the healthy mother itself, is around, it can range between 2.5 or 3 to 3.3 kgs also. And that of infants to the mother of, if you just go to the low socioeconomic groups, that is, as I said, it starts from 2.5. So it may be around 2.5 or 2.2 or around 2.8 kgs. So a well-to-do mother, it is 3 to 3.3 kgs, and low socioeconomic status mother, it can be around 2.5 to 2.8 kgs also. Now, an infant can be considered having a low birth weight if the birth weight is less than 2.5. So, a full-term baby with less than 2.5 is referred to as low birth weight infants. Now, a birth weight of less than 1.5 kg is termed very low birth weight, and less than that, that is 1 kg, is termed as extremely low birth weight, and it is of high risk being associated with it. Now, the normal growth is an indicator, as I said, of the nutritional adequacy and overall health of the infants. And it also reflects to the mother also, that is during the pregnancy. Of course, an infant loses about around 6 to 10% of his body weight immediately after birth, which is normal and expected also. A healthy baby will regain the birth weight by 10 to 14, whatever that loss, that is 6 to 10% loss that was there, it again starts regaining by around 10 to 14 days after birth itself. Now, the infant's growth will be rapid over the next 12 months, that is up to 1 year. And normal infants usually double their birth weight by end of 6 months itself, and by the end of 1 year we expect the birth weight in a normal healthy case to be tripled, that is 3 times more than what was the birth weight of the infant. Therefore, if the birth weight of the infant is suppose 3 kgs, then the baby should weigh around 6 kg by the end of 6 months and 9 kg by the end of the first year. Now coming to the length, that is the height, what we say, height we cannot measure because the infant cannot stand. So what we do is we make the baby lie down, and then we have got the measuring tape, and in the tape itself we will measure the height also, and even the head circumference is also taken. So the length and the head circumference are very much sensitive measures than the weight for assessing a baby's growth and indicating the nutritional status. Now, weight, what happens is weight alone reflects the recent, that is the present nutritional intake, and an infant's height, that is length, increases by around 50% at the end of the first year. And the head circumference, which we see, is an indicator of the growth of brain and its development also. So if there is any chronic malnutrition, there is limitations in the growth, which is reflected even in inadequate gain in the head size. Therefore, regular measurements of the head circumference will verify the desirable growth, and the measurement of the head circumference are useful up to 2 years of life. So that is very important. Now, the newborn infants have functional but physiologically immature kidneys. If you just take the physiological organs, so they have fully functioning but physiologically immature kidneys that increase in size and even concentrating capacity in the early weeks of the life. Probably by the end of 6 weeks, most of the infants can concentrate urine as it is seen in the adulthood, that is adults level. So the kidney reaches their full functional capacity by the end of the first year. Now, coming to the heart rate, the infants have rapid heart rate, and it will be around 120 to 140 per minute. At birth, the hemoglobin level of the well-nourished infant is around 17 to 20 grams percent. This, I think, I had, if you just recall yesterday's previous episode, I had told you the infants, by nature itself, it starts accumulating the iron content from the mother's store, and this is very essential, or it is by nature itself, it is such that it can compensate whatever the iron requirement that is there for the first 4 to 6 months, because up to 6 months or up to 4 months, the infant will be only on the milk, and the milk is not providing sufficient amount of iron. It is deficient in iron. So for the supplementation of iron, definitely iron store is been done or is been filled during the fetal stage itself. So that is why it reflects in the hemoglobin pattern, and that is how we say it is around 17 to 20 gram percent hemoglobin in the infants. Now, of course, when once it reaches the 6 months, it slightly declines, and by the end of 1 year, it comes to the normal as it is seen in the adults. That is, this provides a reserve for the expansion of blood circulation and adequate oxygen carrying capacity to the growing tissues. As I said, it is up to 6 months it will be sufficient. Thereafter, we start you giving weaning or introducing weaning food. So naturally, the supplementation will be through those weaning food which we are providing to the infants, and that is how it has been. That is, iron will be provided over there. Now, the growth of the infants is reflected in their activity also. We have to take into consideration even those aspects also. Now we know a newborn baby can suck and swallow and sometimes sneeze and cough and cry when it is hungry also and feel uncomfortable. That is also there. By 4 to 6 weeks, head controls begins and gradually becomes more and more developed till probably between third or fourth month of age. And by 6 to 8 months, the infants begin to sit unsupportedly with the back straight also. Now by 8 to 9 months the infants have, these are the milestones I'm talking about, the infants have more control over the legs and the back and began to creep or crawl, what we say. At these period, the hand starts the grasp, that is grasping increases, that is holding tightly increases, and at about 1 year of the age they begin to stand and sometimes walk unaidedly also. And then simultaneously by the end of 8th month itself the teeth starts erupting. So it's sometimes it starts by 6 months itself. So by 9 months we can see the eruption of the tooth in the infants. Now coming to the next part, that is the we have finished with the growth and development. Now I'm coming to the nutrition part of the infants. So the nutrients. Now, as we know, energy is very important here. So we the energy which is there plays an important role for all the normal functioning, that is both physiological, that is growth and development that is taking place during this period. It is taken care by this energy itself. So this is very essential. Now, an infant needs energy for, as I said, basal functions such as respiration and metabolism, and in addition to the growth and other activities. Now, resting metabolic rate in the infants, if you just take when compared to that of the adult person, is very high. Now, the normal, as I said, the heartbeat, it's a normal pulse rate of the infants is around 120 to 150 beats per minute. So, when seen in relation to the body size, as I said, the energy needs of an infant are approximately double the amount for those of the adults. So, it is more than what is being required by the adults when you compare the total surface area of the whole body. Now, the energy requirement of infants varies throughout the first year. So, increasing as the child becomes more and more active and mobile also. That is when it starts rolling, or it starts creeping or crawling, or it starts walking, etc. Now, the proportion of the energy in the infants gets from each of the three naturally macronutrients, that is carbohydrate, proteins, and the fats. And the major source of energy is nothing but the carbohydrates and the fats. Now, although the calorie needs of infants are high, the amount of feed they consume at a time is very small, because the stomach capacity, which is only about 10 to 12 ml at birth, gradually increases to around 200 ml by the end of the first year. Now, fat being so concentrated source of energy, 1 gram of fat yields a 9 kilocalorie, supplies more energy in a smaller volume. Now, a high fat intake is also essential for the normal brain growth. I think we have got the DHA, etc., which that is omega fatty acids and DHAs. They are helpful and essential for the normal growth and development of the brain. This continues until 18 to 24 months also. That is up to 2 years. So the energy requirement of the infants has recommended by the ICMR is around 92 kilocalories per kg body weight per day from the birth to 6 months, and then it is 80 kilocalories per kg body weight from 6 to 12 months. Now, coming to the proteins, you can see here it is more compared to that of the adult. So, the protein requirement during infancy is higher again than any other age group in the life cycle. Like adult, it is just 1 gram per kg body weight, even in adolescent also, whereas in infancy it is more required. And human milk provides all the essential amino acids uh, uh, to the infants, that is required by the infants. The protein that is present in human milk is easily digested and absorbed. Human milk contains around 70% of the whey, much of which is in the form of lactoalbumin, which can be easily digested and absorbed without any process. And the recommended dietary allowance for Indian infants, as per the Indian Council of Medical Research, is the that is recommended is 1.1 gram per kg body weight per day from birth to 6 months, and later on it is 1.69 gram per kg body weight per day after or from 6 to 12 months. So when you compare it to the adult, it is very, very high. Now let us talk about the other nutrients also. So coming to the carbohydrates, the major source of the carbohydrates in the early infants is nothing but the lactose that is there. Now, as I previously told that the major source of energy is through the fats and carbohydrates itself, and 50% of the energy is derived from the fat and followed by 50% from the carbohydrates. And proteins has been left out because they have got a very important function, that is we call it as protein sparing action. That is the protein can be used for primarily for the growth and development rather than the energy, that as a source of energy. Now, human milk contains amylase, which is around 40 to 60 times more active than in the cow's milk. And nearly all the carbohydrate in human milk is lactose itself, which can be digested very easily by the infants. Now, as I said, the fat in the milk, apart from providing energy, also is very essential and plays a vital role yeah, to the baby in the sense of fullness and then between feeds, etc. And the breast milk, that is the human milk, is rich in essential fatty acids, especially the arachidonic 6 arachidonic acid and the 2 long chain fatty acids that are there, that is EPA, and the other one, that is DHA, that is docosahexaenoic acid. And these fatty acids plays an important role in the neurological development, as I told you before itself, that brain development depends upon this, especially this special type of essential fatty acids. And about 95 to 98% of fat in human milk is observed because the mother's milk or the human milk contains lipase enzyme, which is necessary for the digestion of the fat content, which begins in the digestion process. So that is how it is very important. Now coming to the fat, adequate intake of the vitamins and minerals for normal growth and development of the infant is very essential. Now the milk provides almost all the vitamins and minerals, especially human milk, needed by the infants. You have to always remember the infant's gut is not that well developed, and all the enzymes may not be produced or manufactured in the body of the infant. So whatever that is yeah, minimum is there, that is the milk that provides those nutrients will be assimilated, and the body is prepared for those nutrients itself. So I just gave an example of lipase enzyme is present in the milk, and then lactase enzyme is also there. So these two are the only enzymes that are there, which will help in the digestion process also. So human milk provides almost all the vitamins and minerals that is needed by the infants. And as long as the infant is receiving adequate amount of energy from the human milk, the requirement of nearly all the vitamins and minerals that is required by the infants is being met. Now, although human milk is lower in some of the nutrients, as I said, iron and vitamin D is not there. Infant absorbs these nutrients more efficiently from the human milk than from the other formulas also. Now, when there is no vitamin D, probably the old method which we use is we expose the baby after 3 months or 2 months to the mild sunlight that is coming through the windows for few minutes, isn't it? That is the old way in getting the vitamin D to the body of the infants. But of course, there are many other reasons that has been quoted, but that is one way vitamin D is being also given to the infants. Now, why it is required? Vitamin D, is vital for absorbing calcium and mineralizing the bone, that is strengthening the bones. And if the mother is deficient in vitamin D and the infant doesn't get adequate exposure to sunlight, then what happens is there is risk factor of vitamin D deficiency. Now, as I said, although intestinal bacteria which are there, they synthesize vitamin K, and the gut is sterile at birth. Therefore, a baby is born with inadequate stores of vitamin K may require external or intravenous dosages of vitamin K, but human milk provides adequate amount of vitamin K that is required by the infants. So, and helpful bacteria which are there in the gut of the infants will also help in the growth of, this will help in the growth of the infant's intestinal tract. Now, apart from this, we have got other certain vitamins, that is vitamin B12, which is present only in the animal origin. That is, infants of vegetarian mothers may need a supplement of vitamin B12. Now, human milk, as I said, is not a source of iron at all. So, naturally, there is enough from a store which has been there in the infants, and it can take care of its iron requirement up to 4 months of its life. And by that time, by the age of 6 months, definitely additional source of iron has to be supplemented. So, coming to the phosphorus, the ratio of phosphorus and calcium in human milk is around 2:1, which is very ideal for the absorption of calcium. And along with that, we have got magnesium that supports the rate and of the growth expected by in an infant. Now, infant absorbs around 67% of calcium from the mother's milk when compared to that of the cow's milk, which may be around just 25%. Now, apart from these nutrients, that is carbohydrates, fats, and proteins, and vitamins and minerals, even milk is also very important for infants. So, infant contains more water as a percentage of body weight than adults. So, the body water loss in the infants is also higher because of the evaporation from the respiratory tract. It can be or through the skin as diffusion, as well as higher metabolic rate which is there in the infant. So as a result, infants are sometimes susceptible to dehydration, like from diarrhea or vomiting also. So in such cases, infant needs about 150 ml of water per 100 kilocalories that they consume. So human milk fulfills this need, and supplemental water is not at all necessary for the healthy infants who are exclusively breastfed for the first 6 months. Once the infant starts the weaning foods, that is solid foods, naturally there should be a regular supplementation of the oral, the milk, along with the milk, water should be supplied. So that is why even water is also very important. Now, the next very important aspect of the infants is how do we feed the infants or the toddler, which as I referred it to as an art itself. So it is very important to feed the infants both qualitatively as well as quantitatively, with maintaining the sanitation and hygiene. That is very important, so that it can be healthy also, with no infection or episodes of infection. That should be the goal while you're feeding the infants. So it is very important to understand the feeding pattern or feeding practices of infants and toddlers. Now, it is it is undisputable fact that mother's milk is the best food for any infants up to 4 months or 4 to 6 months. And advantages, I think, yesterday, I mean the previous episode itself, I have spoken about it. It provides all the nutrients, it imparts disease resistance, that is immune boosting capacity is there. Then it is very hygienic, it is less expensive, and it promotes not only the growth and development but also psychomotor and intellectual development, and provides psychological well-being. And of course, very important is bondage between the mother and the child is also there. So those things are very important. But apart from that also, that is, this is up to 4 months, it is very I mean it is comfortable and it can be done. However, some children need, probably there is, yesterday there were few questions also where they said if the mother is not lactating, that is, milk production may not be there in the mother due to various reasons, or she may not be able to feed the child also. Then naturally, if there is no problem, the child can go for, you can she can go for cow's milk, wherein it has to be diluted in the beginning. So dilution can be 50-50. Dilution for, first it should be, when you introduce it should be so for 60 40-60, and then it can be 50-50. Slowly, as the age, I mean the months goes on, that is when it comes to around 1 year, it can be, the cow's milk can be given as such. But there are variations in the nutrient content also. When you compare it with the human milk, cow's milk is slightly lower in many aspects, like it can be the lactose content. So in human milk it is around 42%, whereas in the cow's milk it is just 30%. Then coming to certain types of fats also, it is just 1% in cow's milk when you compare to that of the human milk, which is around 4%. Then human milk is very rich in vitamin E, whereas cow's milk is less rich in vitamin E. Then bioavailability of the minerals that are present in human milk is much greater than that of cow's milk. That is, it is poor bioavailability is there. That is, absorption of those minerals that are present in cows is not to the optimum level, whereas in the cow's milk it is very good quality. I mean minerals which are there can be absorbed in a higher amount. Now coming to the that is enzymes. Human milk contains lipase enzyme, which is plus point, and this greatly helps in the fat digestion. That is, it facilitates the fat digestion, whereas cow's milk doesn't have that one. So in addition, human milk can also serve as anti-infective factors, like which are very unique, which is not present in cow's milk. So it can be the immunoglobulins, which is there, they're present in the colostrum. Then we have got the lactoferritin, which is there in the that is proteins that binds the iron, making it unavailable for pathogenic bacteria. Then we have got lysozymes, which breaks down harmful bacteria and protects against various viruses. Then we have got the lactoperoxidase, which again protects against certain pathogenic bacteria. And interferon, which is there, which inhibits the activity of certain viruses also. And of course, we have got bifidofactor, that is promotes growth of lactobacillus bifidus in the gut of the infants, which prevent the growth of any pathogenic bacteria, and of course helps in the digestion of lactose also. So these benefits are there, and that is why up to 4 or 6 months, where the child has been given the human milk, it has got all the positive or the plus points which benefit the child with regard to their health and nutritional status. And of course, apart from that, yesterday also have spoken about this in wherein colostrum is very important, and colostrum is the milk that has been secreted during the first I mean, as soon as the baby is born. You have got this yellow color, thick and sticky in texture. and this liquid which is there is rich in very protein content and compared to that of the mature milk, which follows the colostrum secretion. And this colostrum is extremely rich in antibodies as well as some micronutrients also. So colostrum promotes the maturation of intestinal mucosa, and this should be given to the infants. So being rich in anti-infective factors, like as I have already listed you, that is immunoglobulin, it can be it can be lactoferrin, and WBC, which is very important for protecting the infant from dangerous neonatal infections. This will be taken care by the colostrum itself. So we can say it is beyond doubt that babies should be exclusively breastfed for at least first 6 months, and if they are not, probably we cannot expect the nutritional status as compared to that of the infants who are best fed, that is human milk is being given to the infants, so it can be slightly lower. However, there may be unfortunate mothers who cannot synthesize adequate milk to satisfy the infant needs. In such cases, supplementation, that is, there is a need to give the milk substitutes to the infants so that the nutritional requirements are met. It can be either cow's milk or the buffalo's milk also, and sometimes commercial formulas are there which are being prepared by the cow's milk or buffalo's milk, that can also be given reconstituted by adding boiled and cooled water and then fed to the babies or the infants. And of course you have to take care of the hygiene over there. Now coming to the next part which is there, that is after 4 or 6 months, when you start introducing the weaning food, that is very important and it is very crucial. So this period is very important, wherein you start with the supplementary feeding or the semi-solid or solid foods that is there, and there you have to be very careful because it is not just the food nutrient. We have to take care of the nutrients which can be easily digested by the gut of the infants, and along with that definitely we have to take care of the hygiene and sanitation also. So that is very important. Now most of the infants in our country, usually we exclusively breastfeed for more than 6 months also, and growth and development will be very satisfactory. And this like as the infant grows, we the amount of nutrient that has been provided, as I said, through the breast milk may become insufficient to maintain the rapid growth that is taking place. So although many mothers do secrete milk up to 18 to for 24 months also in a smaller quantity, lesser quantity, milk alone cannot provide all the nutrients. It is not adequate or it is not sufficient to provide the demand that is there by the growing infant. So naturally a supplementation of the nutrients should be is there or is very essential. Now the baby, wherein we start the supplementation after 6 months, and this process is referred to as the weaning. So the term weaning is used to describe the introduction of a supplementary foods to increase the energy and the nutrient intake of the infants. Now weaning should be even this also you have to take care. Weaning should be gradual process. Introduction of weaning should be gradual process where the infant is slowly taken away from the breast and the mother's milk is gradually replaced with 1 or 2 times by the semi-solid food. So that is very important. Now, what are the preferable semi-solid food that you give is also very important. Now, for that, probably we can say that once it has to be started in a small quantity. Naturally, when you start introducing the weaning food, that is dietary regime, which is there when it starts. And here you have to be very careful while you're introducing the weaning foods also. So that is to say, when you're introducing it, as I told, it should be easily digestible form. So whatever you are selecting should be of easily digestible form, and it should suit the child. So how it is and what type of food do you add or you include is very important. So that is why we say you have to be very careful while you are selecting the feeding or whatever the food that you have selected as an external feed is very important. Now, there are different ways in which supplementations can be given. It can be the liquid supplementation, it can be the solid or semi-solid supplementation in the form of mashed before feeding. So we have got different ways in which the weaning has been given. So if you come to the liquid supplementation, apart from the milk, we have got you can introduce the soups of vegetables and then the green leaf vegetables, etc., wherein if the vegetables or greens or even dals can be given, it is boiled and the water is filtered, and the pure water that is being taken, and in the initial stage you can just feed 1 or 2 spoons can be introduced, and later on once a child gets accepted, definitely it can be the number of spoons can also be, or the feeds can also be increased. Now, once you start with the solid or semi-solid food, it should again a gradual increase should be there. So, in first in a smaller quantity, and then you can increase. So, it can be smashed vegetables can be given, or even the cereal and starchy gruels can be given, or the pulses, that is the cooked pulses can be given in the form of khichdi or even pongal, etc. That can also be done. So that is how we have got the supplementation that is being given to the children. Now, once the child probably comes to the, that is, it attains 1 year, gradually reduction of milk is there and increase of the supplements are there. And here probably the child will be familiarized with the family food, which is very bland, of course, no spices or anything. So before adding spices or seasoning, etc., we just try to remove the dal or the cooked vegetables, etc., and we smash the rice or whatever it is, and then we start giving. Of course, we have got many other ingredients which has been introduced, like we have got the that is ragi flour, which is there, which is sprouted ragi flour is there. We call it as ragi burrito or so. So such things which is been boiled and then cooked and in a paste form has been introduced to the children. So we have got different ways depending upon the requirement, the area, or probably the age factor also, that is which month the child is there. So depending upon that, we can introduce different types of foods, and by the end of first year, definitely egg yolk, instead of yolk, albumin can be given, that is the white part can be introduced to the child. So that is how we start introducing and familiarizing the foods, and then finally after the first year probably we'll start getting them accustomed to the family diet. So that is also very important. Now, as I said, weaning food, the baby has to be healthy. So the process is called, when you start introducing the supplementary food, it is referred to as the weaning food. So it should be gradual, where the infant slowly takes away from the breast and the mother's milk and is gradually replaced by the semi-solid foods. Now, desirable quantities of weaning is very important. So, what is this desirable quantities of weaning food? Now, we have got certain factors that you have to consider while you are formulating the weaning food or the supplementation. Now, the weaning foods given to infants have certain qualities that should be considered during their preparation also. So, the first one is the energy dense. So, we have to think about the energy supplementation over there. So, it should be energy dense food. And as I have also already mentioned earlier, the stomach capacity of the infants is small, hence they cannot consume large quantity at a single sitting itself. Therefore, the food should contain more of energy in small quantity, and additional of visible fat to the food often serves this purpose. That means fat and the carbohydrate which may be there provides us enough amount of energy. So it should be energy dense. So addition of fat, that is visible fat like ghee, can add on, and that is why we call it as the energy dense food. Now, apart from that, semi-solid inconsistency and easily digestible, I said. There, lack of teeth is there in the initial stage. By the end of 6 months, there won't be, when you start introducing the weaning food, eruption of teeth will not be there. So lack of teeth it makes it difficult for the infant to consume solid foods. So weaning food should be semi-solid in consistency so that it can swallow easily. That is thing. And foods like maybe cereals and pulses and vegetables that are cooked very soft and smashed will be very much ideal. And such foods are also easily digestible, and it will not have, affect the digestive system of the infants. And you have to always remember, digestive tract is not well developed equipped with the probably the enzymes that are required for the digestion of heavily, undigestible foods, or even foods that can require more of, or any other digestive enzymes apart from the lactase and the lipase enzyme that may be there that is there in the infants in the initial stage. Now, low in bulk and viscosity is the next important aspect, or the point you have to consider. So, as mentioned above itself, I have told infants cannot consume foods which are of highly bulky foods. So they should swallow it. It should be swallowable. That is, it should be very soft and without any chewing process. So usually malted grains is the best way to provide, which can be in a semi-solid form, and this will be of low viscosity and easily digestible also. And it is also important not to force the infant to eat larger quantity in a single meal. So it may vomit, or probably it can result in diarrhea also. Now, weaning food, definitely we have to take care that it is inexpensive and easy to prepare also. So weaning, why I'm emphasizing on this is commercially available weaning foods are there, which may be very expensive. So it can be done or prepared at home, and then using certain sweetening agents if you want, like malted cereals, and then pulses can be mixed and powdered, and with the jaggery or sugar, and of course with the fat, that is ghee, you can definitely have a good and inexpensive, and which can be easily prepared, hygienically prepared, and then it can be given to the fed to the infant, which is very much suitable to them. And of course it will be fresh, and it will be clean also, that also, and it should be sterilized as much as possible, and that is how you can give. So as I said, 4 to 6 months, even the fresh juices, and 6 to can be given. So it can be in the form of, I said, soups. It can be boiled vegetable water, or the mashed and strained vegetable soups. It can be, or even pulses also, I said. And the frequency also, you have to be very careful. 3 feeds per day can be done. To start with, it will be just one feeding per day, then you can have it 2 times, or again you can start with 3 times per day also. And you will have to remember, it is the supplementation is, you are going to replace 1 or 2 times of the breastfeeding. So that is very important. Now, once it comes to around 9 months, mashed bananas can be given, even certain fruits can be given, like apple, and then, as I said, mashed pongal, which is very bland in taste, can be, that is rice and combination of rice and dal, especially green gram dal, can be given to the baby. So this will be mashed, and even mashed vegetables also can be given. Now, after 9 months, there's eruption of the teeth also. So probably the chewing can be initiated over there. So you can go for varieties of vegetables, and as I said, even the albumin part of the egg can be introduced if you're a non-vegetarian. And if you're a vegetarian, definitely vegetables can be boiled and then can be given to the infants. So that is how the weaning should be, when you have to take care of all these desirable qualities of the when you are introducing the weaning food for the infants. Now, what are the health concerns during the infants? So this is very important. So especially it also affects the nutritional status of the infant. So you have to be very careful with everything. So if you are feeding bottle feed, feeding the bottle, tooth decay can be there. Then iron deficiency can be there. Sometimes milk allergy is there, and the failure to thrive is also there. So that means to say you have tooth decay during infancy, that is dental caries, what we say, can result from putting the infants to sleep with bottles filled in with milk or anything like that, especially carbohydrate rich liquids which are there. After once you start with the weaning, all these problems starts. So infants usually get a soothing feeling when they are sucking on the nipple. So mother tends to put them to sleep with the bottle itself. And when this is prolonged for a long period of time, the carbohydrate in the milk can produce or nourish the decay and producing the bacteria and cause dental caries also. So the upper teeth are mostly commonly affected because the tongue protects the lower teeth. And although iodine is sufficient in the body, it can last for 6 months, as I said. But we have seen infants can develop a deficiency due to inadequate dietary in iron intake after it starts with the supplementation, that is the weaning food. So you have to choose the food that is rich in iron content. So feeding of milk alone is not recommended. Instead, you have to go for external or fruits which will supply all the required nutrients for the infants. Sometimes, as I said, there may be some allergy of for the milk also. Now, depending upon the situation or condition, formulas based on cow's milk or maybe lactogenic reactions, allergic reactions are there. Supplementations can be given with some of with the formula based milk that is there without lactose or whatever it is, that can be recommended, and it is based on the prescription given by the doctor. You can go for that. Now, failure to thrive is a term used when there is a decrease in or maybe slowing down of the physical growth observed using a national standard growth chart. I think you should remember every month the child will be weighed. When you go for the checkup or whatever it is, the child is weighed, and a card has been given which we call it as the growth chart, where the child's weight is being marked on the graph. And we just see the graph by the end of 1 year. We just see the graph whether it is in the growing period, that is whether it is in an increasing order or not. Now, if the weight of the infants is slightly lower when compared to that of the standard that has been given, like we have got the block, bands like green band, then yellow, orange, and red bands are there. So, depending upon where it falls, probably you have to be very careful when it falls beyond the orange band, or in the orange band or red band is very serious. So you have to be very careful. So when an infant's weight for age which is there falls below that, the standard growth chart, it is diagnosed as a failure or to thrive. We say it as the child is not strong enough, and somewhere there is some problem. So that means it is not taking, I mean, the weight is not increasing, or the growth pattern is not normal. Based on, I mean, after you have to elicit the information, or probably find out why, or what is the failure, or why it is so. If there is decline in the growth rate, or if it is not into the maximum level what it should be, then based on the when you compare it with the standard growth chart, so based on the reasons for the failure to thrive, it has been classified. As I said, we have got green and yellow band, then all those bands are there, wherein we refer it to as different ways it has been referred, grades of malnutrition or whatever it is. So in such way it has been marked, and then we should start with the verification, and probably medications is also very important. So that is one thing you have to always remember. Now, the failure to thrive can occur among all socioeconomic groups. It need not be just low socioeconomic groups or whatever it is. So children can have, depending upon the cause of it, maybe the maternal malnutrition can be there before consumption, or probably even in the breast milk also, if there is no sufficient nutrient supplementation, so maternal malnutrition can be there, or probably mother is alcoholic, or smoking is there, or probably she is on medication, or maybe infections during pregnancy may be there, or probably even inborn errors of metabolism can also be one few factors which may refer to the growth failure due or reasons for the growth failure, that is failure to thrive, what we call it as. Now, all these things can chronic disease or disorder known to interfere with the normal nutrient intake, absorption, metabolism, as well as excretion. So that is why there may be problem with the things. And sometimes we have got other environmental factors also we have to take into consideration, like psychological factors it can be, and it can be associated with the interaction between the infant and the caretaker, that is primary caretaker, maybe the mother or the grandmother or whoever it is, or poor feeding skill may be there, dysfunctional family interactions, or poor parent child interaction, or lack of preparation for motherhood can be there, and that is psychological problems, or lack of support can also be referred to as the reasons for failure to thrive. So this is like we categorize the failure to thrive factors as organic and inorganic. Organic is due to some diseases or disease condition or disorders, and the general factors like environmental and psychological factors, we say it as non-organic failure to thrive. So that is how it has been differentiated. So these things also you have to take care, and that is very important. Now, coming to the next aspect is the childhood. Now, this again is very important, and usually we say it starts from two years to 5 years. So, up to, actually we say it as from 1 to 3 years, and 3 to 6 years we say. So, 1 to 3 years we refer it to as the toddler, and 3 to 6 is referred to as the preschool children. Again, maintaining proper physical and social cognitive development in this age is very important, and it majorly depends upon the adequate energy and nutrient intake. Simple reason is, whatever that has been taken care during this period, it will have an impact on the later on stage in the life. That is why it is very important. And you also have to remember about malnutrition occurs in the preschool age itself, and it is very important that it is taken care. And it may probably come in the way of not only just the physical growth, but also the physiological growth, that like it can hamper the growth development of that is mental growth also, that is IQ etc. can be impaired, or it can affect it due to various types of malnutrition that can occur if a proper nutrient or nutrition adequacy is not there according to the demand of the child. So that is very important. So you have to take care of the child here. Now, growth and development of the child here is very important, as I said. During the children, that is the preschool age, it is very important to have, to know the reasons why nutrients have been emphasized. Now, this period from 1 year, we to, of course, puberty also, we call it as latent period of growth. So 0 to 1 years, it is one phase, and the next phase is referred to as the latent period of growth. And because the growth rate which is there is not as drastic which was there in the infancy, and of course it will be there in the adolescent also. So between that, that is between infancy and the adolescent period, that phase which is there, we call it as a latent period of growth. But definitely there is a steady pace in the growth and development also. However, the growth in the social or probably cognitive and emotional area is nevertheless it is significant, and maintaining proper physical, social and cognitive development in this age group, as I said, is very important, and it definitely depends upon the adequate nutrient intake. So starting from energy to any type of nutrient, micro or macronutrient intake. Now coming to the growth and development of the this that is school age, preschool or school age. As I have mentioned earlier itself, I told after the first year of the rapid growth, physical growth rate slows down until puberty, that is adolescent. And if you just recall the earlier this thing information, we learned that the birth weight triples during the first year. I told you, infants, when the baby is born, it has been made, and we expect by the end of 1 year, if it is a healthy baby, definitely we expect its weight to 3 times more than what was there in during the birth. So in the after the birth, so this, in this contrast, if you can just take to that, it takes another year of birth weight to increase 4 times, and similarly length increases just by 50% in the first year, but is doubled only approximately by the end of the fourth year. So thus the increment in change are small comparatively with which was there found in the infancy, and same kind of probably intensity will be found even in the adolescent also. Now, usually the increase in weight is around 2 to 3 kg year, per year, and until the child is 9 to 10 years of age. And likewise, the height increase is around, on an average, we can just say it is around 6 to 8 centimeters per year from 2 years up to the puberty. Now, if you just come to the composition, I mean, proportion of the body, there is a significant change in the body proportion of young children after the first year of growth. Now, the growth of the head and the trunk slowly slows down considerably, while the length of the limbs increases subsequently. Now, consequent to increased physical activity and walking, and then legs become very straight, and the back of the muscles also gets tightened up. So these changes are gradual, and it occurs over a period of years. Now, coming to the body fat also. Now, the body fat decreases gradually during the early childhood year, reaching a maximum of around, maximum at maybe around 6 years of age. Now, of course, there is sex differences. Boys have having more lean body mass compared to that of their height, while girls will have higher percentage of weight as a because of the fat content. Now, a child who is recovering from illness, or maybe undernutrition, or whose growth has slowed, will have a greater rate of growth, and this usually we refer it as catch-up growth, we say. See, when you just compare them to the normal healthy children, so maybe they had illness for a short period of time, or so because of that illness, maybe fever or so, or even the common cold, etc., they had lost their weight. But once they recover from that illness, definitely their growth rate increases for that period, short period, and this rapid growth for a short period is referred to as the catch up growth, and this is a period during which the body is striving to catch up with the normal growth curve which is there. So rates of catch up in weight gain can be sometimes 20 times faster than the normal in the children who are both stunted and wasted also. Now stunted and wasted, definitely, that is stunted is low height for the age, and wasted is low weight for the height. So these two is nothing but due to the deficiency of nutrients, especially protein deficiency is there. There is no growth at all, and as a result, and even the protein which has been stored in the muscles will be utilized. So we have got the wastage of the muscles. That is to say that proteins that are used by that are there in the form of muscles will be utilized for the energy purpose. So they start losing their weight over there. So as a result, there will be low weight for their height, and again there is low height for their age first of all, and their weight also decreases. So we see both the stunted and wasted in the children who are malnourished especially. And when they cannot be, as we see in short illness, if a child is for a short period of time, the child had an illness, he starts recovering, as I said, catch up growth is there. But when the child is malnourished, and the child is suffering from both stunted and wasted, he cannot have this pace or that speed recovery in and increasing in their height or weight 20 times faster or whatever. That cannot be seen in such children. Now, once catch-up growth has reached an approximate weight or height, for the height, and the rate of weight gain is approximately 3 times of the normal rate expected for the age. Now, of course, we have to do periodic assessment for the growth in the children, and it is very essential. It is the simple reason is to detect and cure any problem that can be there at the early stage itself. Now, for this, you can, you can recall, or you have seen Anganwadi workers are there every month. The child is weighed for on a particular period day. And again, that is also marked, and they see if the child is falling in the yellow band, or in grades of malnutrition, what we say. So it can be normal, that is green, and then grade 1 if it is yellow. Orange is grade 2, and red, when it comes to the red zone, it is grade 3 malnutrition. So this is been recommended by the NCHS, and they compare it with the standards that is being given for the Indian children, that is with the percentiles, what we call it as, for the Indian scenario. And they compare it, and then they state whether where the child falls, whether it is the normal child or undernourished child. So depending upon the condition, that is the grades, the child may be cured there itself in the household, at the household level, with the nourishing food, or maybe supplementation when it falls in the second grade, by the prescriptions or supplementations given by the medical personnel. Or if it is in the serious case, that is 33rd grade of malnutrition, definitely it needs care in the hospital itself. So hospitalization is there. So that means to say regular monitoring of the growth is very important, and this enables the early identification of any problems that can be there. And sometimes intervention or education can be given to the mother or caretaker also, so that it can be the child can be recover, or you can overcome any deficiency is there or not. So that is how we have got these things. So I just wanted to show all the requirement. Now coming to the requirement, I told you again here, nutrient requirement for preschool child, it is the energy need for children are determined on the basis of the basal metabolic rate, the rate of growth, and the physical activity, which is very important. So you have to be very much careful about what you're giving to the child, and what type of food is given. Usually food which is rich or bioavailable is very important. This is because the children are growing and developing, especially the skeletal system is becoming more stronger in this age group. Like it can be the bones, it can be the teeth, it can be the muscles, and the blood volume is there. So they need more nourishing food in proportion to their weight than do the adults. And as I said earlier, risk factor of malnutrition increases if there is any poor appetite for a long duration, or there is no supplementation, nutrient supplementation, or nutrient adequacy is not there. Definitely it leads to the risk of malnutrition. So that is very important. Now the energy, as I said, needs are determined on the basal metabolism and the rate of growth and physical activity. It is very important that the diets of children should supply adequate energy to support all these things. Now, if the supply of energy is insufficient, proteins will be utilized for the as a source of energy. And you know, proteins are required as a body building material, or that is why we have to spare that for building up the body. So instead of just giving as a source of energy, so that means to say, for this adequate amount of energy should be supplied. At the same time, it is also important to ensure that energy is not excess also, because it can lead to childhood obesity. So that is very much common now in India. So you have to be very careful while selecting the food also. So the suggested macronutrients for energy is 50 to 60% should come from carbohydrates, 25 to 35% from the fat, and 10 to 15% of the energy should be from the protein itself. Now coming to the proteins. Now, proteins, as I said, the need for protein gradually decreases. We saw it in the infancy. It was around 1.69 grams per kg body weight. So now it starts reducing. So the need of protein gradually decreases as the child starts growing older, and decreasing from around 1.2 to 2 kg 2 gram per kg body weight in the early childhood, to around normally coming to 1 gram per kg body weight in the late childhood. That is, by the end of the 6th year or by the end of the 10th year, the child will require just as it is seen in the adulthood, that is 1 gram per kg body weight. Now, coming to the minerals and vitamins, this again is very important. You have to be very, very careful about this micronutrients, and micronutrient deficiency is very much common in Indian children. So you have to be very careful with this. Now, preschool children are risk at have a high risk of iron deficiency anemia, along with malnutrition. Malnutrition, it is not just, see, it is because of allergy as well as proteins, we say. But once there is malnutrition, onset of malnutrition is there, you know, the child cannot digest properly. So episodes of infections are there, and it can lead to many disease condition. I'll come to that later on. So the deficiency of other nutrients are also seen. So the reason for this could be the rapid growth during this period is marked by an increase in both hemoglobin and the total iron mass. So in addition to that, the child's diet may not contain adequate sources of iron, which may result in iron deficiency. So it need not be just malnutrition. See, even in a healthy condition also, sometimes we have a risk of iron deficiency anemia. Now, calcium, you know, calcium is at high demand because bone, teeth, that is, calcification, that is growth and development of the skeletal muscle is very important over there. It becomes more stronger. So calcium is very essential for mineralization and maintenance of the growing bones. So milk and other dairy products are the good source of calcium because it contains maximum amount of calcium. And of course, certain proteins are also, amino acids are there, which are very good, and we call it as a complete food. Therefore, children, complete protein food. So therefore, children should consume enough amount of this food so as to there is no risk of calcium deficiency. Now, vitamin D is also very essential for the, obviously, for the absorption of dietary calcium and its deposition in the bones also. So, adequate exposure to sunlight with the help of which will help in the synthesis of this vitamin is in the body is very essential. So, what we do is we children should expose to the sunlight for the vitamin D. Now, other micronutrients is zinc, which we usually see, and deficiency of zinc results in the growth failure, poor appetite or increased taste, and the poor healing, wound healing, especially wound healing capacity comes down with the deficiency of zinc also. So zinc deficiency is being seen common among the preschool or school age group children. Especially, we have seen this in the middle and low socioeconomic families, income families. So you have to be very careful with that. So uh, uh, here we have to just say that calcium, vitamin D, and iron and zinc deficiency are seen. Of course, other nutrient deficiencies are also there, but these are the major deficiency which we usually encounter among the preschool children's. So you have to be very careful with these things. So I just said about the calcium, vitamin D, and the zinc. Now, coming to the next aspects, what are the factors that influence intake of preschool food intake of preschool children? So, obviously, environmental factors plays an important role in probably creating an environment and a model to the preschool children or the school children. So it should be a model wherein children ask for food which is more healthier than which may not be required by them or which may not be very much healthy. So that is very important. So like that, we have got the sociality influence, that is society, media, then peer influence, and illness or the disease condition. Let us start one by one. Now, as we learned earlier, physical growth is slower during this period and it is not consistent. So, similarly, food intake too is not inconsistent. Appetite usually follows the rate of growth and nutrient intake, and probably what was a good appetite in infancy may become a fair or poor appetite when it comes to the, especially the preschool children, and changes in food consumption are often reflected to the nutrient intake. So compared to the nutrient intake of infancy, this period, that is especially the preschool and school years, shows a reduction in certain vitamins and minerals. I told you micronutrient deficiency is very much common in the preschool children. Now, several factors are there, as I said, which influence the food intake. The first one is the environmental factor, as I said. Young children usually imitate the parents and the older siblings. So it is, or probably those who are the other individuals, maybe those who are in their immediate environment. So you have to be very careful in what you are doing, or how the environment is there in the family during, especially during the that is when you're having food or whatever it is. Now, food attitude of parents have been shown to be a strong predators of food likes and dislikes of the children also. And it is not clear as how much this is attributed to genetic influence, but definitely whatever the parents or the siblings see, I mean, show, it is definitely influenced, and they are the first influencer, right? It is also common belief that young children have an innate ability to choose a balanced diet. However, it may not be true, but by nature itself, they have got this way of choosing things. So, therefore, parents or whoever are the caretakers are responsible for giving a variety of nutritious food for the children, and it is very important to maintain a pleasant, that is very important, pleasant atmosphere during meal times. And as I said, because this too has a profound influence on food intake, arguments or emotional stress while eating, or may have certain, I mean, in negative impact on the child also. Now, societal influence is also very important. Like there may be the economic constraints can be there, and when the mother is employed outside, also that can also be there. So as a result, children often eat one or more meals at daycares itself. So they'll have a limited or restricted food choice may be there, so which may have an impact on their food habits and even eating pattern also. And even at home also, due to time constraints, and probably traditional meal preparation is increasingly replaced by nowadays, ready to eat fast foods, etc. That also can have an impact on the children. So especially I can say that maybe 2 decades or 3 decades before, in probably rural areas, if you just go, they would this thing, especially noodles were not at all there in their list of food purchase. But now it has become so much that it is an integral part, whatever there is. But noodles have been taking a prominent place in their list of purchase. So that is how the societal influence is there on the family or the children also. So it can be, as I said, it can be the economic status, or it can be all those societal influence which is there, can have an impact on the food choice by the children. So you have to be very careful, or whatever the factors do influence the food habits of younger children. Now I think media is making a lot of changes, and with their attractive advertisements on television, colorful and fast moving pictures, or probably catchy tunes, and of course buy one and get one free, and even some, I think we have got the toys that has been given along with that a particular food item which you purchase. So all these things gain attention, and the children are more influenced by these things at all. They may want it or not want it because of the colorful thing or the plaything that has been there. They do go for it. So such type of food may be, I mean, low quality. We call it as junk foods or so, which are high in maybe sugar and fat, which may be wrong kind of food for the growing children. So it is very important that such habits should not be inculcated to the children. So you should not encourage them probably or to such demands or whatever it is. Now, apart from this is peer influence, we usually were seeing it in the adolescent period, but the peer influence is very important here also. Now, since up to 1 year, I mean 3 years, they were inside the house. Once they step in out of the house and they start going to the school, naturally they'll have the social contacts. They become very important to them, and they see new things, and thus they are more influenced by the surroundings which is there. So this peer influence on food choice increases with actually the age itself, and it will start in the preschool age itself. As a result, the child may suddenly refuse to eat food that he was liking before or previously, and demand for more other foods that are probably popular in their peer or friends, and that can be there. And this type of an action can be temporary also, but once it is taken care by the parents or the caretaker, definitely a positive behavior can be reinforced. That can also be done, but it is very essential. I just my experience, I would always repeat this with everyone. Like I had this experience with my own daughter. She used to ask for a pink rice every time. And she used to say, my friend brings a pink or purplish rice. I was wondering what it is, and what it should be. So once I just went to the school, and fortunately I could see her, the friend's mother also, and then I spoke to her, and then it was nothing but curds rice mixed with beetroot, she said. So that is how, see, it is just the simple food, but it was attractive, and it was attracted. So that is how the children get influenced by such things also. And of course, we have got the other important fact which we have, like illness or disease is there. And children who are ill, usually their appetite comes down. So an acute viral infection can be there, maybe for a short period of time also. So nutrient intake can be hampered, and children, they appetite comes down, so naturally it may have an impact on them. So that will be a temporary phase, and definitely it can be or probably it can be overcome by some treatment or so, or probably after the recovery the child may become to the normalcy, and it can have the same as it was before the illness, that is food intake and other things also. So that is how the impact or influence is there with the family or society or the media or the friends, etc., which is very important. The first four components which are there, or the factors which are there, are very, very important in the child's life, because it will be exploring new things and new world. It will be entering into the new world. So that is why we say it is very important. Now, feeding of preschool children is again an art, we say. So, how well you feed the child depends upon how well you want to plan it, or what is your intention, or probably the goal in which you have to, which you want to achieve. Now, this period, as I can say, is a period where the children don't want to spend more time on food. That means to say they are in the play mode. So, minimum or less time will be spent on food, and more time in play. So, they skip meals, like probably when they are going to the school, also, sometimes their school lunch box will not be. Excuse me. Will not They will not have eaten at all sometimes. So they'll have skipped the meal, and all those things are there. So it is very important for us to take care, and what type of food that has been given or provided to them is very important. So you have to plan in such a way that in a small quantity you provide them nutrient dense, that is food suitable for the children. Maybe the cooked cereals and vegetables, then pulses, and all those things can be given in the form of upma or khichdi or whatever it is. But the way you prepare is also very important over there. Many a times, as I said, normally up to school children or age also, we have this problem of feeding the children, especially with the vegetables. So a suggestion is, like, you plan in such a way, like now, media influence, or the peer group influence, or societal influence, what we were talking about, and the availability which is there, like pizzas, burgers, and other things are there. definitely now all mothers, we have learned many things, many dishes which we try to imitate those things. So maybe a paratha with all the vegetables that are there, or even the I mean greens which are there can be filled as a paratha in the puris or even in the chapatis, and then probably vegetables on the chapatis itself as a pizza. So many things are there that we try to modify and make it more colorful for them. That is very important. And I, as a mother, will be satisfied that with a small bulk, see, bulky food is not accepted by them. So with a small quantity, you are providing them all the nutrients, and that should be your goal to feed the children if this age group. So that is very important. So dense food, nutrient dense food in a small quantity rather than the bulky food is the major main goal of it. Now, again, here the nutrition concern is, as I said, obesity. Now, it is because of the junk foods or probably the empty calories that has been there. Like we working mothers or even mothers who are at home also try to imitate, like we have got easily available fast foods, 1 minute things, and just dipping it in boiling water and preparing it, which may be just empty calories, like as I said, pizza or burger, etc. I mean, so many things are there. I mean, pastries, or it can be any bakery items. Though consumption of such foods are becoming very high every day, and the problem is it has resulted in obesity. Few of my students who did research on such, I mean, school lunch programs, which is there, they arrived at a conclusion that even it is not just, there's no bias in the economic status in the school lunch what they provide us, like it can be even sometimes pastas and noodles and such things are also being given to the children, wherein it is just an empty calorie that is there. So and even, I mean, biscuits and chips and such things are being provided in the school lunch, and as a result obesity is there, and there's no bias, that is economic bias is not there. Even nutrition education, I mean, if they have, if they are aware of the healthy food, or if they are aware of the nutrients also, there is, I mean, because of the unavailability of maybe they are working women and they depend upon someone else for cooking purpose, or so many reasons are there. So as a result, children are now, I mean, obesity is more common in children also. Of course, we have got this underweight and failure to thrive also is common in the preschool children. As I said, protein energy malnutrition now yeah, I mean, in Karnataka, as I said in the previous episode, it is around 48 to 52% are suffering from different stages of malnutrition, and especially with protein and energy, that is calorie deficiency in combination, like both cash worker and marasmus is common in the preschool children. So that is how I mean, that is very important to understand. So I mean, underweight has become very high in the children also. On the other hand, where there may be different reasons for it. My unavailability of adequate nutrients can be there, or availability of food may not be there. So many things are there, or so many problems are there. Economic problems may also be there. So low socioeconomic group can, I mean, are more susceptible to such things, or episodes of infection can also lead to underweight, and there may be failure to thrive also. So those things are there. And dental caries as such, as I told you, especially with the chocolates, I mean, carbohydrates, simple sugars, they keep it on for a longer period of time, and eating more of these empty calories, and then sugar candies and such things have resulted in the dental caries among the children. And this can be also attributed to the unhealthy personal care also. And the last one is the constipation, and this is very common in children. Simple reason is dietary fiber is rich food is not included in their diet. As I told, eating vegetables or making them to eat vegetables is becoming very, very difficult, as I said, and they don't want to chew properly and then eat it is, because of time consuming and other things, they don't want to go for such food. They just want something which is soft and which can be swallowed in a short period of time. So such, because of that, constipation is again a common thing that has been problem that has been found in the preschool children or even the school children. And apart from that, definitely habit also is there. So personal habit also is there. Every day going having a good habit definitely may not be there, rushing to the school in the morning and then coming back in the evening and again going to the play, etc. That might have limited their evacuation process every day, so that can also be a contributing factor for constipation. So that is how we have to take care of constipation or probably the obesity also together. We can handle it together because both are related to a common, that is dietary factor, dietary fiber. So can be included through the vegetables and the cereals and pulses, so that adequate amount of these can supply the required amount of dietary fiber, and obesity can be reduced, and along with that constipation can also be reduced. So this nutritional concern for preschool children is very important. You have to take care of things. So I think I completed few aspects and concerns related to the infants and preschool children and school children. So if you have got any queries, I'm unlocking now. You can just ask questions, or we'll have a discussion. And if you have got anything to part in, you can definitely most welcome. You can do it. I have unlocked your microphones and videos. You can we'll start with the discussion. No questions? Yeah, Shashikala.
What about
Pardon? I can't hear you, Shashikala.
ma'am? What about school lunch program, ma'am?
School lunch program definitely is there. School lunch program, see, it is a nutrition program which is been given by the government, adopted by the government. In that way, we have got Anganwadi centers, midday meal programs are there, and definitely now it has become a prime this thing. Wherein initially the goal was to increase the number of students, that is attendance, to increase the attendance. It was not just the care to take care of the children's health condition, but also the attendance. And of course, children were leaving the schools, and just to increase the admission, that was one of the criteria. But yes, definitely school lunch programs are doing well, because now they are providing nutritious food every day with the milk, addition of milk, and in the mid morning. And that will take care of one third of the day's requirement. So the other two require, that is two portions has to be supplied by the in the house, its home itself. So it is just one portion of the whole day's diet that is required, has been provided to the children.
Thank you, ma'am.
Yeah. Yes. Mohammed,
Madam,
yes, sir.
this session I'm unable to view. It's not coming in the laptop, ma'am. Actually, it's coming only in the mobile and the
Oh,
font.
I don't know. I mean, you should go for Chrome. Then you'll be able to visualize
Earlier, no, no,
properly.
earlier, Hema
Huh.
ma'am's class I could view in the laptop. I think there is some
Hmm.
problem with the link.
No. See, others are viewing. It is not just, it is not that problem. You just once again verify it. Yesterday, could you do it?
No, ma'am. Yesterday also I couldn't do it. I'm only viewing in the mobile. That's the problem, actually.
Okay. Yeah, is it through, you just see if it is through Chrome or whatever it is, because others are comfortable, and this is not the second class, because since 2 months we are using the same platform, and issues were not there, but definitely I'll see that what has happened, and definitely I'll speak to the manager also.
Okay,
Okay,
thank you.
Mohammed, you have asked for the weaning food, isn't it? See, weaning food is a supplementation that we start after the 6 month, along with the milk that has been fed to the infants. Okay. Now, this weaning food, we have got different ways in the which the weaning foods are given. It can be a liquid form, it can be a semi-solid, and the solid form. So, usually it starts from the liquid form and then to semi-solid and solid. Liquid is we just give soups like vegetable soup. It can be strained. It need not be very thick. It will be just boiled vegetable water, what we call it as, or the dal water, what we call it as. Those things will be fed to the infants after 6 months, along with the milk. Whether it is the mother's milk or the cow's milk you are giving, one or two feedings will be cut down, and it will be replaced by the feeds, that is weaning food that has been given. So then apart from that, we have got the semi-solid foods, like we have got vadragi, to what we call it as, that is malted ragi flour has been initially started. The core part of the ragi flour is used of it will be used, that is ragi will be used, and it will be in the form of a paste, and we try to feed the child or the infant. And later on it can be mashed vegetables or mashed cereals will be there. And once the child attains 9 months, there is slowly eruption of teeth is there. Then you can go for soft boiled foods like vegetables or cereals and pulses also. So the weaning mainly is for infants when you start the supplementation after the 6th month of its age. Some infants and toddlers, I think Vidya has asked, toddlers don't sleep well at night. What can be the problem and what can be done to avoid it? Like this, I think it is very difficult to answer. Like infants, sometimes they may sleep a lot in the morning, and they may have a disturbed sleep in the night also, or sometimes the feed which the mother is giving may not be sufficient. Then also child or the infant becomes very cranky because of the hunger. So that can also be one of the reason. You have to monitor and see what is the problem, and then you can go for it. Now, colic babies, I'll be explaining this when we talk about in the dietetics part. Okay, this will be done in the dietetics part, so we'll just restrict to today's this thing. Some infants excrete more often in a day. What can be the issue? See, if the excretion is in a solid or semi-solid form, that is no problem at all. But if it is very like diarrhea or very watery excreted, then it is serious problem. You have to take care. You have to see what is the problem. Maybe infection is there. Maybe hygiene is not maintained during feeding process, or maybe the weaning. If you have started the weaning, definitely the child requires time to adjust. That is, the gut requires times to adjust. So that can also be a result. As a result, diarrhea can be there. So that is the problem. So you have, again, the issues has to be studied, and then only you can come to a conclusion. Now, can you explain the reason behind lactose intolerance? See, it can be inborn this thing a problem in the child itself. So there is no actual reason for lactose intolerance also. Yeah. Any other questions and queries? Yeah. Hello, sir. Any questions, sir? See, for zinc, I mean, green leafy vegetables, and for at this age, I don't want to specify anything particular, but green leafy vegetables and the other vegetables can be emphasized for the children. As I said, it can be given in different forms, and it can be fed, like as I said, it can be along with the vegetable, I mean, chapatis. It can be formed as parotas, or even puris also. Colored puris can be prepared, and all such things. So you can give all the, I mean, include vegetables and greens very much. Sir, I can't hear you, sir. Chaman, sir, I can't hear you. Probably you have not muted. I mean, you have to unmute your microphone, sir. Yes, Ram Krishna, sir.
Can you tell me this is a lactobacillus bifidus factor, madam?
Yeah, see, it is there within the body, I mean, gut of the infants. So this is the only bacteria, that is, we call it as friendly bacteria, that is there, which helps in the digestion process, and especially the lactose that is coming from the milk is digested by this, and it also gives weight for the manufacture of the micronutrients, especially B complex vitamins, has been initiated with the presence of this bacteria. So it is the only probably I can say a form of enzyme. It is not an enzyme actually, since the gut is not strong enough to provide. I mean, produce the enzymes. It
Yes.
acts as an enzyme in the place of the enzymes, actual enzymes.
This is a probiotic, isn't it?
Yes, yes. See, it is, I mean, by nature itself, it is already there in the infant.
Okay, okay, okay.
Mm.
So, okay.
Yeah.
Thank you.
Welcome, sir. Mm, Mama, is it much more? Potatoes eating is good for school children, school age children. See, potato curry or potatoes eating usually in the infants, in the during. I mean, when we start with the semi-solid or mashed way, we start with the weaning. We give small pieces of potatoes because it is energy rich. As I told you, we have to concentrate initially on the carbohydrates and the fat content. So we do start with the vegetable list. We start with the potatoes itself because it is very mashy, or which is very soft, and it can be easily swallowed also. It can be mashed easily and swallowed. So we go for this. But too much of potatoes, again, since it is just a starchy food, definitely you have to have it. Just provides us carbohydrates and nothing else. So you have to have the other nutrients also. So too much of potato curry or potato can be avoided, or you can replace it with any other vegetables. Yeah, any other points you added, or okay, Vidya is typing something.
Can you tell me what is casein, madam?
Casein is milk protein.
Protein, is it?
Yes,
Casein is a
it is.
protein.
Yes, yes, yes. It is protein. in the milk. Weigh and see, probably if you just squeeze lemon and we have got, you separate the mean, curdling is there, separate ಮಾಡ್ತೀವಿ channa anta ಕರಿತೀವಿ ಅದನ್ನ, isn't it? So it separates, liquid separates. That liquid part is whey anta ಕರಿತೀವಿ, that is also rich in protein, and the solid part which is there, it is a type of protein which we see in only the milk, casein anta. Yes.
That casein is that is which form that casein is this is available? In which form?
Sir, it is in the milk itself. It is in the milk itself. Now, casein can be, I mean, they are available in the powder form also. If you have seen the that is milk formulas that are available commercially also, they are also casein form itself. And for experiments, certain animal experiments, we go for protein feeding. We take this casein itself as a media, I mean, for means of protein supplementation. Eating spicy foods as adults is fine with toddlers? Definitely not. Definitely not. You have to always remember the intestinal tract is still developing in the toddlers, especially as I said, 1 year, I mean after 1 year also, and spicy foods should be slightly avoided. So definitely you have to have a bland or less spicier food, introduce less spicier food for children especially.
Okay.
Yes. Vidya, I think you have understood. Few foods like channa form gas in the stomach. What can be done to treat it at home? See, sometimes we have many ways in treating at home, as I said. Sometimes we boil channa and then we discard the water, but I don't recommend that at all because nutrients are present in that water itself. So probably as a home remedy, I can tell inclusion of the ginger and garlic slightly can reduce the gas formation. But again, sometimes it so happens in each individual they have got the flatulence formation in the stomach, so it can differ from each other. So you have to consider that also. But in a simple way, I can tell you definitely the ginger or garlic can help you to reduce the gas formation in the stomach.
Okay. This also work as a phytochemical agent, is it?
Yes, sir. Definitely, it is a phytochemical. It acts as, I mean, health improving and helps as a phytochemical. Definitely, sir.
Okay.
Yeah.
Okay. Thank you.
Welcome, sir. Hope there's no questions and queries. Hope you have understood today's concept, and I thank you for your patience listening. So let us continue tomorrow with another age group, and then I'll be winding up the class now. So let us end the meeting now. Thank you once again, students.
Thank you, ma'am.
What is the subject? What is the subject tomorrow? Hello.
Yeah, Naniga, sir.
What is the subject tomorrow? What is the subject tomorrow?
Sir, I think we'll start with adolescent tomorrow.
Yeah.
One more age group which is also very critical. So we'll start with adolescent, and probably I may add the elderly or so if time is available. Otherwise, I'll complete off the adolescent itself. And in the next class, we can club elderly and adulthood over there.
Both. Okay then. Okay.
Yes, sir.
Okay.
Yeah. Okay, sir. Thank you very much. Thank you once again. Pardon, sir?
Okay. Thank you.
Yeah.
These are all the problem questions they will ask in the examination, is it?
Yes. Yes, sir. And we have, I think, uploaded the question papers, old question papers also in the website. You can go to our website and you can just have a look at the old previous question papers also.
Recently you uploaded, or very long back you uploaded about
No,
3-4 months?
recently we have uploaded. Recently we have uploaded all the question papers, sir.
Oh, I see. Probable questions are Because the questions, what
No,
you
previous
see,
question papers we have uploaded.
okay, okay. That I will see that.
Okay, sir.
Thank you.
Okay.
Thank you. Very
Yeah,
kind of you.
welcome. Welcome, sir. Welcome. So I'm ending the meeting. Thank you once again.